How are you guys? I'm Eric.
Okay.
Everybody here should know me, but that's okay. Go ahead.
What is a UTI?
Urinary tract infection or an inflammation of the urinary tract.
Urinary tract infection.
It's a urinary tract infection.
A urinary tract infection.
It's a urinary tract infection.
A UTI. Urinary tract infection. What is a UTI?
No, urinary tract infection.
What causes it?
It can be caused from sexual intercourse, not cleaning yourself properly, bacteria.
Bacteria in the urethra or the ureter.
E. coli?
A lot of different things. Not going to the bathroom before and after sex. Sorry. Dehydration, bacteria if you wipe back to front.
From not being clean, you know, things along those lines of being like dirty and, you know, not really like taking care of yourself and
a lot of UTIs. And then healthcare providers has a lot to play also. For example, patients who have folic arthritis, they are also very, very susceptible to UTIs because most of the time when they have folies, the healthcare team, you see the folic arthritis on the floor, they don't give them, you know, AM care properly, they don't clean it up, they don't do what they are supposed to do. So there's always bacteria climbing down from the floor and, you know, the folies become contaminated and then these patients have UTIs. So very, very, very important that when you have a folly, you take very good care of it. And then sometimes one of these patients who have folly, when they are walking on the unit in the hospital, they have it above the bladder. The folly is drained by gravity. So they should be able to, you know, position the folly in such a way that there will be no backflow. That can also cause UTI.
I don't know how to describe it. It's what, isn't there multiple reasons for it? Isn't the way what you eat can cause one? Can cause a urinary tract infection, or if you're not properly cleaning yourself. That's what I know about it.
Burning when you pee, smelling urine.
Can hold your pee. It hurts when you pee. Sometimes bleeding if it's like, you know, really advanced. But
Burning, frequent going to the bathroom, blood in your urine, cloudy urine.
A lot of complications. When the infection travels to the kidney, for example, you might have, you know, you can develop problems in the kidney. You know, eventually you can have kidney strictures. You can also actually, it can affect your mental status orientation. You know, most of the time, if you know, you are nurses who work in the ER, especially the adult population, when they come to the ED and they diagnose them with AMS. AMS means altered mental status. Most of the time, these patients, especially the elderly, have urinary tract infection. It's not that they are crazy or they have delirium or anything. It's just UTI.
What are the
doctor? No, I don't really know. The doctor sees and diagnoses. I don't know how the doctor diagnoses it actually. I think he does a urinalysis test or something.
What?
Antibiotics is the way you go through a physician, and then there's some home remedies like cranberry juice and stuff like that.
A urinary tract infection is a bacterial infection that enters the distal urethra and it ascends along the bladder. The bacteria binds to the urinary tract epithelium and it results in acute inflammation. Depending on where in the urinary tract the UTI is located determines the name of the UTI. So if it occurs in the urethra, it would be called urethritis. If it occurs in the bladder, it would be called cystitis. If it occurs in the kidney, it would be called pyelonephritis. The urinary tract actually filters the body from liquid waste, and it's composed of the ureters, the bladder, the urethra, and the kidneys. The causes of a UTI would be E. coli, which is actually the most common cause. When E. coli leaves the gastrointestinal tract and it moves into the urethra, it can cause a UTI. Women are usually more susceptible because women have shorter urethras, and it's within close proximity to the anus. Conditions also known to cause a UTI would be urinary retention, abnormal flow of urine from the bladder back to the ureter, kidney stones, bladder catheterizations, spinal cord injuries. Any conditions that suppress the immune system. Also in men, if they have an enlarged prostate, it can also make them more susceptible to UTIs because it inhibits the flow of urine. The symptoms of a UTI would be strong continuous urge to urinate, burning while urinating, blood in the urine, cloudy, smelly urine, bacteria in the urine. Tests that would be used to diagnose a UTI would be a urine sample, which is used to determine if there's any pus or any bacteria in the urine. And the patient is usually asked to give a clean catch, which is when they urinate midstream into a sterile container, which is then analyzed. And a urine analysis is also another test that can be used. Urine is tested and analyzed for red blood cells, white blood cells, and bacteria that may be in the urine. And this also tests to see what abnormalities may occur in the urine. And antibiotics are given, and specific drugs are given to determine if a UTI is present.
A UTI is usually not serious if treated right away. If left untreated, it can travel from the urethra to the bladder and kidneys. Pyelonephritis, a kidney infection, is serious and can cause permanent scarring and damage to your kidneys. The infection may then spread to the bloodstream, causing the body to become septic. Recurrent UTIs may cause scarring in the kidneys, which over time can lead to renal hypertension and kidney failure. Antibiotics are the main treatment for all UTIs. A variety are available. Choices depend on if the infection is complicated or uncomplicated, or primary or recurrent. Other factors include gender, whether you're male or female, pregnancy, age, if you're a child or an adult, hospitalized or unhospitalized patient, or if the patient is a diabetic. The prognosis is usually very good for UTIs. Uncomplicated UTIs can be successfully treated with oral antibiotics, and most patients are free of infection within a week, although the rate of recurrence remains high. Ways to prevent a UTI include drinking plenty of water to help flush bacteria from your system, don't hold it in when you have to urinate, wear breathable and cotton underwear that don't trap heat and promote the growth of bacteria, wipe from front to back, and also taking vitamin C supplements increases the acidity of urine, which helps to decrease the amount of bacteria in your urinary tract.